get started? Good afternoon, everyone. My name is Patrick Robinson from Alumni Association, and welcome to the free workshop, The Efficacy of Animal Therapy in Residential Facilities for People with Autism. This is a master's project presentation, and it's being videotaped. Please check your cell phones or smartphones and turn them off or vibrate until the workshop is over. This workshop goes until from 4 o'clock to 5:30. We also have a name stickers or name tags in the back, and we have a survey for workshop, and also for those alumni who's attending this workshop, there's a survey for the alumni to finish, complete. Beth also has her survey for her workshop. So if you could take time to complete the survey and give us feedback, we'd really appreciate it. Thank you, and here's Beth.
Hello. Familiar faces is comforting.
Yeah.
My name is Beth McNally, and I'm a student here at Adler. I am finishing up. This is all I have left is my master's project and graduating in May. So it's taken a little bit longer road than I thought, but I'm finally at the end stretch. So thank you all for coming. We are going to start off actually with an early recollection. And for those of you that don't know what early recollection is, it's something that we learn here at Adler where we take a memory, the earliest memory, and then we sort of analyze that with our clients to come up with mistaken beliefs, beliefs about their life, what they believe about the world, men and women. So I'm going to start off with that. And can I have a volunteer to share an early recollection? Anyone? You will? Do you mind sitting up here with me? So the way an early recollection works is you're going to tell me the story and I'm going to write it down word for word. So just go slow and I'll kind of guide you, give you time to write it down because I want to make sure I get it word for word. So I want you to think back as far back as you can to a memory that has anything to do with an animal, whether it's a dog, horse, a bird, fish, anything that you can think of. And the first thing is let me know what age and then let me know what you say.
I have one fresh, so I was about 3.
Okay.
And I've always been told that I don't remember this story, that I've been told it so many times that I really don't know if it's in my mind or not, but I really remember this story. My dad came home into the driveway, which our driveway went all the way into the backyard. This stuff. And when my dad got out of his car, and he noticed I was in the backyard holding the collar of a big golden with the one hand I had the collar, and the other hand I was petting the dog, saying, "Nice puppy, nice puppy."
dad came home into the driveway. Our driveway came all the way back to the backyard. And when my dad got out of the car, he noticed I was holding the collar of a big Doberman Pinscher. With the one hand I had the collar, and the other hand I was petting the dog, saying, "Nice puppy." And my dad slowly came up to me and said, "Sandy, let go of the dog." My dad said it a few more times, and I finally let go of the dog, and the dog ran off. So when you think of this memory, I want you to tell me what the most vivid moment is of that memory. Like you're taking a picture of it and tell me what that moment is. And with that vivid moment in your mind right now, can you tell me what emotion is there? Why happiness?
I remember being as tall as the dog, and the dog was very friendly and seemed to like me, and I liked it, and I'm happy with it. I love it.
So the next part of an early recollection is that as a therapist, you would make some hunches about the lifestyle of your client. So I kind of want to do that as a group to come up with, and if you're not from Adler, you don't need to join in, but if you are, and you have ideas of some hunches about Sandy's early recollection, I'd love for us to discuss that as a group. So if you come up with any, just shout them out or raise your hand.
Sandy, you respected your dad's authority, so maybe you saw dad figures as authority figures. Is that possible?
That's true.
One of my hunches is you mentioned that the dog made equal size with you, and so you felt a level of equality there, a sense of safety.
I think confidence strikes me, even as a 3-year-old. You were quite confident in your ability when you picked out what entailed. You just were able to do this.
Yeah, I didn't think twice.
Anyone else? Marina?
But it also be piggybacking on what Lynn said, that things are not as scary as other people tell you they are.
Not believing everything I hear, maybe, or believing my own core belief instead of other,
Making your own
making
judgment
my own judgment. Yeah.
and acting your, not just making, but acting your judgment.
Almost resisting.
Resisting is acting.
Yeah, true.
You showed a real trusting and warm nature at 3 years old, which now you'll see some kids not gentle at all. Happens to always dog.
I think that's what scared my dad the most.
He saw the thing, yeah.
Nice puppy. It's true.
Well, thank you for volunteering. Okay. So today our topic is we're going to explore how the unique approach of animal-assisted therapy reaches into the challenge areas of someone on the autism spectrum disorder, and it provides a safe and empowering experience for learning and growth. So that's what we're going to talk about today. Let's start off with defining what is animal-assisted therapy. Animal-assisted therapy is a goal-directed intervention in which an animal meeting specific criteria is an integral part of the treatment process. It is designed to promote improvement in human physical, social, emotional, and/or cognitive functioning. Animal-assisted therapy is provided in a variety of settings and may be group or individual in nature. This process is documented and evaluated. I've listed here some goals of animal-assisted therapy, and of course there's plenty more that could be listed, but these I chose to show you today because of how they would apply to someone on the autism spectrum. One is to increase verbal interactions between group members, to increase attention skills, to reduce anxiety, to increase vocabulary, to improve willingness to be involved in a group activity, to improve interactions with others, to improve interactions with staff, and to increase exercise. There's another form of animal-assisted activities, which is actually different than animal-assisted therapy. But we'll define animal-assisted activities first, where it provides opportunities for motivational, educational, recreational, and/or therapeutic benefits to enhance quality of life. Animal-assisted activities are delivered in a variety of environments by specially trained professionals, paraprofessionals, and/or volunteers in association with animals that meet specific criteria. So you may be wondering, what is the difference between these two? And we're going to go through them up here. So with animal-assisted therapy, which is what we're talking about today, it's a significant part of treatment for many people who are physically, socially, emotionally, or cognitively challenged. There are stated goals for each session. It's individual treatment for each patient. Notes are taken at each session. The visits are scheduled, and the length of the visit is predetermined to best fit the needs of the patient. Animal-assisted activities are more of a casual meet and greet activities that involve pets visiting people. There's no specific treatment goals. The same activity can be used with many people. Detailed notes are not necessary. The visits are spontaneous, and the visits can be as long as short as desired. You may also be familiar with the term service animals. That is different than an animal-assisted therapy pet or animal. Service animals are trained to meet the disability-related needs of their handlers who have disabilities. So these are the animals that actually live with their owners, and they are trained to specifically help someone who maybe is blind or deaf or in a wheelchair, and they can do things that that person cannot do. So it's different than a therapy animal. And some of the needs would be caring for oneself, walking, seeing, hearing, speaking. These animals help assist with those needs. So again, an animal-assisted therapy animal is not a service animal. So now I want to talk a little bit about the history of animal-assisted therapy, and it goes all the way back to the 1790s. In 1790, in the United Kingdom, a place called the York Retreat encouraged mentally ill patients to walk through the gardens and interact with and care for numerous small domestic animals. Then in 1867, animals were used in the treatment of epileptic patients in Germany. Here, the patients were allowed to interact with and take care of animals such as birds, cats, dogs, and horses. In 1919, in the U.S., dogs were used with psychiatric patients at St. Elizabeth's Hospital in Washington, D.C. In the 1940s, the Pauling Air Force Convalescent Hospital in New York encouraged veterans to work with animals at the center's farm. And then in 1942, they introduced a planned program involving dogs. Most of these patients were victims of fatigue, had physical injuries, and needed rest and relaxation. They interacted with reptiles and amphibians that were in the nearby forest as well. Then, in World War II, Corporal William Wine was recovering in an Army hospital in the Philippines, and his pals brought his Yorkshire Terrier, Smokey, to the hospital to cheer him up. Smokey immediately became such a hit with the other wounded soldiers that the commanding officer of the hospital unit decided to have Smokey join the program and be in the hospital. In 1962, animal-assisted therapy was formally introduced by Boris Levinson in his article called "The Dog is a Co-Therapist." This story about Levinson, I love this story. He was working with a nonverbal child, and in between his sessions, he would have his dog come into his office, and then when his patients would arrive, he would take the dog out. Well, one day this nonverbal child showed up, I don't know, 10 minutes early, and his dog was still in the office. And all of a sudden, the boys started to interact with the dog and started talking. And Boris noticed this and thought, oh my gosh, here, this boy is finally talking. So Levinson coined the term pet therapy because of this. He noticed that it not only softened children's defenses, but it also provided a focus of communication for these children. In the 1970s, Elizabeth and Sam Corson used pet therapy with adolescents and adults, resulting in most patients showing improvement in self-confidence, self-respect, and an increase in their socialization with staff members. So there are a lot of types of different therapy animals, but really any animal could be termed therapeutic. I'm sure if we have animals at home, they're therapeutic to us. But specifically, a certified animal, not every type of animal can be certified at this point in time. There are various agencies that certify animals, and some of them are dogs, llamas, horses, cats, rabbits, and guinea pigs. You may be familiar, if you know about animal-assisted therapy, with the Delta Society, which is now known as Pet Partners. In the cities, our local Animal Humane Society uses the Pet Partners certification program to certify animals in animal-assisted therapy. So, Pet Partners defines themselves as an international nonprofit organization that helps people live healthier and happier lives by incorporating therapy, service, and companion animals into their lives. Equine-assisted therapy. From the research that I've done, I've seen most animal-assisted therapy organizations or groups out there that do equine-assisted therapy. And Acres for Life is a local farm that does equine-assisted therapy. They define it as a practical modality incorporating a licensed therapist, equine specialist, and horses that has proven to have a profound impact on individuals, youth, families, and groups. It addresses a variety of mental health needs, including chemical dependency, depression, grief and loss, eating disorders, anxiety, communication issues, attention deficit disorders, autism spectrum disorder, emotional behavioral issues, and relationship challenges. Hazelden Treatment Center here in the Twin Cities, they partner with Acres for Life, and they do individual and group treatment at the farm with using equine-assisted therapy. So now we're going to take a little discussion question break. I would say groups of 3 to 4, maybe with your tables, and it's just some questions to get us thinking about how animals have impacted us. So. Something that was new to them, just to kind of bring it to a large group discussion.
Cat therapy with chickens.
Cat therapy with
Cats,
chickens?
yeah,
Oh,
cat therapy with chickens.
what about?
Well, I learned that from.
Oh, cool.
Welsh.
Yeah.
Yeah.
So I thought that was very, very curious.
Isn't
about,
that awesome?
Yeah.
Yeah.
Welsh is the uses therapy chickens.
Yes. I actually, at the end, I'm going to pass out an article that is about, it used to be Minnesota Link, but it's with Tanya and Molly, and they talk about the chickens. And they talk about how there's this one black chicken that has feathers like sticking out everywhere, and they sort of represent it as, this chicken sort of being different from the other chickens, and kids who maybe feel that way, and how they can relate to that. And, so I remember reading that about those chickens.
through divorce transition, it's really helped my kids. It's been
Okay.
just very grounding for my son. He holds on to the dog. But then I didn't say that when I was growing up, going through the same thing, my mom would sort of give a lot of animals away. She'd get them and then she'd give them away throughout the transition. So my brother ended up, I ended up loving animals and feeling like I needed them through the transition.
Yeah.
My brother ended up hating them because he felt they were always given away.
Right, so he had that negative experience
Yeah.
with animals, yeah. And that's such a good point that we can have positive and negative experiences with animals. And I remember when I first started at Adler and I was talking about this is my passion and I want to work with animals in therapy, and one of my instructors, made a good point that, that it's not always going to be the best thing for people, and it kind of helped me start thinking about that this isn't for everyone, and that some people have negative experiences. Or so the point she made was that some people, if they're really comfortable with animals and they're scared of people, that would block them from connecting with humans and would become more isolated and more socially anxious. And so that was another good point. So it's always good to look at every side of this. Anyone else want to share animal stories? They're so fun.
I told you, we owned Bichon Frises for over 15 years.
Yeah.
We saw one on the ride here,
Oh.
and I said it still could just light me up like
Yeah.
nothing else. We saw one that looked just like our male, and I actually haunted the lady. But it could just you could be in any kind of mood, and
Yes.
when you had a breed or something.
Yeah.
And we also said how they act like magnets and bring people together, because
Yes.
we see people at the park, and if they have dogs, or when we have dogs, they engage people you normally just might walk past.
Yeah, absolutely. I think animals are huge connectors for us as human beings, especially if there is anxiety or it's awkward. And like I was saying in the history about Boris when he's working with his nonverbal child, and how that child was able to speak just by being near an animal, just by petting it, how powerful that is. So, yeah. Okay, so I'm going to start off the next segment with a video. It's actually a trailer of a documentary called The Horse Boy. And the reason I show this is because it shows the organic and what I term spiritual side of animals, and how they are healers across the world. They've been healers in indigenous cultures for many, many years, and this story talks about going to Mongolia and how they use horses in their healing. So it's just a short video that I'll play.
In April 2004, my son Rowan was diagnosed with autism. The feeling was like being hit across the face with a baseball bat. Our lives became clogged under a mountain of conflicting information on the disorder. We tried everything. He didn't speak to us. One day, he ran away from me and ran right up to a horse called Betsy. The moment I put Rowan on Betsy's back, he began to speak.
He's a nice horse.
As Rowan began to open up to me for the first time, a light bulb went on in my head. Was there a place on Earth that combined healing with horses? Mongolia. This is a story about how, as a family, we did something crazy. How we ended up going halfway across the world in search of a miracle.
I think it wasn't exactly Ron's vision of Mongolia.
We're going to go up a several thousand-foot mountain and perform a 4-hour ritual of shamans. Isn't that what all families do? Sometimes I think he's like leaping forward, and sometimes it's like he's totally regressing. I couldn't help wondering, did I really have his best interest at heart here?
I don't know how useful it is to think of us as normal and Rowan as the sick one.
And then something happened. Rowan began laughing, giggling. We were together again as a family. but we're onto something good here.
So that brings us into the topic of autism. Autism is a group of developmental brain disorders with a wide range of symptoms, skills, and levels of impairment that generally fall into these three categories: social impairment, communication difficulties, and repetitive behaviors. In the DSM, the diagnosis of autism requires a total of 6 or more items from the three areas, with at least 2 in the area of social interaction and at least 1 in the other 2 areas. Here I've listed some traits that a person with autism may exhibit, and these are, I have quite a list, and I want to show that these are not, for someone to have autism doesn't mean that they have all of these traits. For someone to not have autism doesn't, if they have one doesn't mean they don't have autism, or if they have one it doesn't mean they do have autism. So the traits are insistence on sameness, resistance to change, difficulty in expressing needs, uses gestures or pointing instead of words, repeating words or phrases in place of normal responsive language, laughing, crying, showing distress for reasons not apparent to others, tantrums, difficulty in mixing with others, may not want to cuddle or be cuddled, little or no eye contact, unresponsive to normal teaching methods, sustained odd play, spins objects, inappropriate attachments to objects, prefers to be alone, and has an aloof manner. Apparent oversensitivity or undersensitivity to pain, no real fears or dangers, noticeable physical overactivity or extreme underactivity, uneven, gross, and fine motor skills, not responsive to verbal cues, and acts as if deaf, although hearing tests are in normal range. This is a quote, persons with autism are as different from one another as apples to oranges. Actually, apples to nuts. And this is from a play a woman wrote who's a mother of a child with autism. He's now an adult. But really, her point is just that, someone with autism is going to display very differently from another. So you can't really group them in terms of, oh, someone with autism, that means they do this, or they don't do that, that means they don't have it. Some common interventions. The Association for Science and Autism Treatment lists several types of therapeutic interventions, including animal-assisted therapy. Some other ones are applied behavioral analysis, sensory integrative therapy, and biofeedback. Now we're going to do a sensory activity, and for this we want 3 groups, so you had 3 groups before, you can choose the same group. And what we're going to do is I'm going to pass out some things that I want you to reflect on the senses, so touch, scent, mostly touch because that's a big one in terms in the autism community. And then talk to your group about them. I have questions again to talk with your group about what comes up when you are around these objects.
Bringing up comments about not everyone on staff cared about caring for the animals.
Right.
And so that whole issue of who is going to monitor animals in a situation like that to ensure that there isn't abuse or that they're cared for properly and all that kind of thing.
Absolutely, and that's why I would say that a workshop or a certification program that the staff has to go through in order to work at this group home. So they know how to take care of an animal, and they're passionate about it. They're passionate, and they're also passionate about doing animal-assisted therapy.
And maybe even backing it up one step further about before even putting them through a workshop, do they have the capacity as staff to really care about the animals? Because that was kind of what I was seeing, is that the staff would be coming on board, but they were not necessarily liking to take care of animals.
Right.
And so it would fall on a few people to do it, and so there was a lot of kind of friction about that whole thing.
Absolutely, and I'm an animal advocate, so that would be something that I would say is extremely important, that these animals are cared for just as much as the people are cared for, that it's a win-win for both species. Yeah.
One question, can you be a little bit more specific when you're talking about taking care of animals? What is the scope?
So,
So
yeah, that's a great question. Great question. So if we have animals at our home, we are responsible for them. So we need to feed them, we need to walk them, we need to brush them, we need to take them for walks. So this is what I mean by animal care, is making sure that these animals are cared for, and that's the residents would be a part of that as well as the staff.
if it's a farm, then you're not talking just about animals that can reside within residential areas.
So this would not be a farm.
Oh,
So this would be there are farmsteads that they use, they do work with farm animals. This would be a different situation. This would be a community group home in the city where they have dogs and cats, rabbits, guinea pigs, whatever, yeah. So, thank you. Anyone else?
Can I see your resource page again?
Yes.
I'm writing them down. Thanks.
Paulette?
Are there any models for group homes like that in Europe? Do you know?
Not that I know of. Okay.
I just wondered if anyone was doing that. It's such a good idea.
So, in your presentation, there's only animals with the 4 legs, like mammals, but I was wondering about marine or aquatic animals,
Yeah.
birds,
Yeah.
use
Yep.
therapy.
Yeah, absolutely. What I know of dolphins is one that's big that they use. But again, a lot of animals aren't yet able to be certified as therapy animals. So like amphibians, lizards, they are not, they can't go through a process yet. There isn't an organization that will certify that. So there is a limitation, and that's why I kind of listed those more common ones, but dolphins is one for sure.
So what's the certification process? What's involved in that?
From what I know is that, at least at the Humane Society, I actually went through a class about cats. And they have, like I said, Pet Partners is sort of the main hub organization that they do the sort of certifying through. And it's really, they do kind of like a test where they'll have little obstacles set up and you walk your animal through them, and they have to be able to be touched by, strangers, or they have to be able to not get too scared if there's a loud noise or something sudden happens. So they go through a process to make sure that they're safe, that they're calm, they're, would be appropriate therapies. Yeah.
Residents and staff for allergies.
Can you say that again?
How do you test staff and residents for allergies?
Allergies? Well, that would be probably up to them on their own to be tested for allergies and whether or not it's something that they could handle or not. If the allergies were severe, it wouldn't be a good program for them, for staff or for residents, unless they wanted to take care of it with allergy shots or however anyone takes care of allergies.
And I would think if you're bringing in residents into a facility that has animals, they would be signing off on an informed consent or some sort of liability piece that they didn't have, certainly when they weren't allergic to animals.
Yeah, and I mean, what I know is that there's a lot of people that have animals that are allergic. People own dogs and they're allergic to them, they still own them. So it's really a personal choice if someone wants to be in that or not. Because I know veterinarians that are allergic to animals. So, yeah.
So I don't know if maybe you said it or I missed it, but in your internship as you were going through your graduate program, did you do mostly that type of work, or?
I actually did not do any.
Okay.
I'm still waiting to do this, so.
Okay.
Yeah.
So have you been involved, or at least done something with these organizations, or seen them, or interfaced with them in any way? Or?
Well, the Natural Connections Learning Center, when it was Minnesota Link, I actually interviewed with them to do my internship, but I did not get it, obviously. And like I said, I went through the cat therapy program at the Humane Society, which was really seeing if your cat would be able to be a certified therapy cat. So. Yes, please, please. We have people that do animal assisted therapy, equine assisted therapy, and so share your resources.
I raise and train border collies, have been raising for 13 years. Before my grandfather was raising since the early 40s. I've been involved in equine therapy, which is, there's a place out of Pine City, Brook Park. It's called Changing Gates, which it's online and you can check out their website. It's a Christian-based program. My oldest border collie, who is now retired, has been a certified therapy dog and has worked with two different groups and stuff. Sandy here has actually two of my border collies, and one of hers is a therapy dog and the other one's in training. So, and we've both been, our dogs have gone to TDI, which is therapy. Therapy Dog International. Yep. Yeah. So.
Both Deb and I are addiction counselors, and my certified dog actually does addiction therapy with me, and is kind of like there's different views on, different philosophies on it, but I consider her a co-therapist.
I know Dan Zenga had, when he was, I don't know, is Dan Zenga here anymore?
Yeah, he's, yeah.
Oh, he brings his dog with him. He had like a Labrador, he
Yeah.
brings like every time he would work.
Yeah, I think Catherine Hedberg has a dog that she uses sometimes. Janet Goodermont has a dog. I don't think theirs are certified, but they have had them in the room with them when they're doing therapy.
I've used mine a couple times, but my dog's not certified.
Oh,
Yeah, she still has her cat though.
okay. Thank you. Yeah.
Have you seen any place where
Did you speak
really
up?
small dogs in used or available for this type of therapy? Real small dogs.
Really small groups.
Dogs. Small
Small
dogs.
dogs. Have I seen them? I haven't seen them, but there's no breed that's like excluded. So any dog, if it has the right temperament and can pass the certification process, can be a therapy dog.
So can you get them or buy them or
The
some?
dogs?
Yeah, I mean specific
Pre-certified?
type. Yeah.
I don't think pre-certified.
I don't think so.
No.
You
Because
gotta imagine the price.
Yeah.
Right. And the therapy dogs, I think too, I mean, you have to, you have to be working with that dog and get that dog to interact with you and you with the dog. And talking about the little dogs, when my border collie went through her certification, there was a gal who was in a wheelchair and she had a tiny little poodle about that big. And that little thing got certified. And I'm like watching it and I'm like, are you for real? and it went through, that dog followed her around the arena because there's different obstacles you have to go through. They come around and they drop a book that was about like that and drop it. And so to watch so your dog doesn't startle. There was food, they had food out there so your dog doesn't like go up and take the food away or another dog that's there. There's all sorts of different things that they do. But this woman was going in and around with her wheelchair and had this little tiny dog walking next to her. The dog, I think the dog was probably better than mine. Like, holy cow. So,
Any place where they train dogs?
Pardon?
Any particular organization training dogs? No?
Training them to be therapy dogs?
Yeah.
No, not therapy dogs. There's service dogs, which we talked about. Service dogs for people with disabilities.
Yeah, it's
They get trained by organizations and then paired up with those people, but not therapy animals. But that's a good idea.
So you would have to go through the training with your dog. And that's part of the deal, is it's the bond between you and the animal.
So it's one-on-one. It's not that animal can be trained and become available
Right.
to her.
It's the professional has
It's
to do
fair.
it. Yeah.
It's fair. It's fair.
Yeah, it's like you're training your children and you don't give them away so they become other people's children.
No.
Okay, Okay, thank you.
Thank you.
We're gonna So as Patrick said, there are two different surveys. One is for the Alumni Association, and then the other one is for me specifically.